Howdy, everyone. Matt here. I got a question for you. What do you do in a situation when another healthcare provider comes at you to say, oh, you're not a real doctor, and we just laugh at you therapists who do that, who call yourself a doctor? What do you do in those situations? But first, let me introduce myself. I am Matt the PT, and I'm coming at you with another video on another topic of something that goes on in the rehab world. Second of all, let me thank you for taking the time out of your day to tune into the video. Thank you for the likes. Thank you for the comments. Thank you for the subscriptions. And of course, if you enjoy this video, hit that thumbs up and join in the conversation. I want to hear your experiences, your beliefs, your thoughts on all of this, because this is something, it happened this week, and I posted about it on my Instagram stories. It was pretty big, and I want to hear from you all on this whole situation. Now, what happened, you may be saying? Well, a colleague of mine, a friend on Instagram, posted a video story. It said 7 years of school for a doctorate degree of PT, $200K plus in debt, hours of studying and perfecting the craft, only for patients to ask for a massage and to call me pain and torture. Now, I want to say about the video, this is one thing that I do see other therapists talk about. You know, it's just a little complaint about something. Is that bad? Heck no. I don't think that's bad at all, because honestly, can you find anyone who work, any profession where people don't complain about some aspect of it? You know, I would say I've seen tens of thousands of patients in my career, and a vast majority, when we come start talking to work, they have some sort of complaint about it. The hours, something. I've had a cake decorator complain about how difficult, and I'm not talking about like those super nice cakes. I'm talking about like the grocery store sheet cakes. Like, so I can say, I've heard everything. We all have that. Now, on this said post, we'll call them random provider, decides to put a comment because, people just can't, be nice, and, they just got to put their comment on there. And it said, from a doctor, from the in front of your name, in orthopedics, we actually laugh when we see a therapist do that. Ego tripping. You're a physical therapist. Get over it, but drop the doctor, please. So spicy. Now, in that case, one, a doctor's not a profession, which I always comment whenever I see, the trolls that come out and do this. When they see, when they want to get a little jab in on you that you're a physical therapist with a doctorate, and you call yourself doctor, you're not a real doctor. Well, I'll point this out. Doctor is the designation of a degree awarded, not a profession. Because that's what it is. It is not a profession. It is the term it's the designation of a degree that somebody has earned. Now, he decided to single my comment out, and he said, correct, but English teachers don't use the title. Well, that's funny, because I remember many teachers in my undergrad using doctor, and heck, I had an elementary school teacher who had the designation of doctor because she had a doctorate in education. Don't use the title. So I guess they don't do that. And he said, you're a narcissist and just a physical therapist. To request to be called a doctor on a daily basis, you better be sporting MD/DO at the end. So spicy. Now, I do correct people with myself. I don't actually have a doctorate in physical therapy. I have a master's degree. So I tell people, no, I am not doctor. But if you have a doctorate of physical therapy, yes, you're doctor. Insert your last name or first name or however you go. And so I made sure to comment back. An English teacher with a PhD can have the designation of doctor and use it in any situation, including a hospital, which you can. I understand that you've got a fragile ego, but you do realize that we're all on the same team. And I had a few other little comments that we're going to get into. Now, big bad random provider over here to comment, Matt, go find a friend or someone to listen to your nonsense. And then he did the big tough thing, is that he blocked me, and then I couldn't respond to him. I will say the therapist that posted this pinned his comment to the top, and he's such big, bad, scary provider that he went and deleted it and then blocked it. Now, Come to find out from many of you, looking this person up, found out that this person is a physician assistant. So someone who doesn't even have the designation of doctor. However, that does bring up the point that I want to talk about. This person is a physician assistant in orthopedics. I work in orthopedics. Many therapists work in orthopedics. We're all on the same team. And issues kind of come up with that. And I have seen that happen many, many times. More online really than in person. But I think many of the ones online are just people just trolling as being jerks. But in person, seeing that, I have seen that from physicians, nurse practitioners. I have not actually seen it in person from a PA. I've had very good relationships with physicians, assistants, nurses, chiropractors, different people that have this super big ego about what they do, and they look down on people that do work in other professions. So like physical therapists, they think that, oh, you're nothing, you can't do this, or you can't, and they have this ego about themselves. And I'll tell you, where I am in my career now, I really make sure I point that out. I don't run into many of them, where I am now, physicians that have egos or that come at me, but I will tell them straight up, hey, aren't we all on the same team? Are you able to do the things that I do? Are you able to do their rehab? Now, I'm not saying like, oh, I'm going to do no. Do you actually see a physician, a primary care, an orthopedic surgeon, a neurosurgeon, whatever? Do they actually take the person through their rehab? And when I say that, I mean like, okay, bring the person in, do any kind of manual therapy, have them do the exercise, prescribing them the exercise, not just saying, here's a sheet, but doing the exercise, making sure that they're doing them right, making sure that they're progressing with it, coming back in. How many do you actually see do that? Probably very rarely. But what do? Oh, go to PT. Because that is our specialty. That is what we do, in any area. I work in orthopedics. So yes, if you're a physician, you're going to send to me because I know how to do the rehab. And I met physicians who do that. That one recently, he does a lot of orthopedic surgeries. And he stated, I do the surgery, you do the rehab. Let me know how it goes. He actually changes up his surgery based upon the rehab outcomes. And because, so there was a thing actually talking about him. He was doing a new procedure with ACLs, and he was talking to the therapist to say, hey, let me know how these outcomes are going with this rehab. Because if it's not, he's going to change up what he does. I think that's great. I think that's great to find out like, hey, these people are taking too long to get better. Maybe they're not getting full extension. Maybe they're not getting full flexion. They're having some lingering issues. It's taking us too long to get this. He's going to change up the surgical approach. I think that's great. Now, again, I'm not going to get into all the details about all the other stuff about, hey, yeah, someone is affected. But a surgeon saying, hey, I trust you to do the rehab component of it. Now, I will say situations like with this PA, I let them know, and I will let any other physician or whomever know, who spends more time with the patient. Is it us as the physical therapist? So think about it. How much time do you spend with your patients? 1 to 3 times a week for an hour or more each time. So in the grand scheme of things, what are you with somebody 12 hours, 10 hours, 12 hours, 20 hours, 30, 50 hours total for the length of the time that they're going through this condition? And how much time, what would say that this random PA is with them? Maybe a total of an hour total the whole time, because this only in there for a few minutes typically. They're not running through their exercise. What does that say? We build a very, very good relationship with our patients because we spend so much time with them. So much time. How many of your patients can you name all of their kids or their grandkids or where they work or their pets or where they went to school? You can tell people, you know so much about their lives because we've spent so much time. And patients just, they have it. They have this bond. Do they actually have that on the other end with it? And I tell, Now, this is something that we can do with that, with, and I'll bring this up to physicians, not in a bad way, but to say, hey, with direct access, I spend a lot of time with patients. I am a good marketing source for you on that. Think about it. If you're treating a patient and, we'll say direct access, the patient comes in with shoulder issues and they need to go see someone about their shoulder, are you going to just go, oh yeah, just go, go find somebody and then just come back and see us? You typically know who they need to go see. Who is the shoulder person to go see? And I tell a surgeon, hey, how would you like to almost guarantee that you're going to get a patient in your office? Because hey, if I treat this person for a couple of weeks, they're not getting better, and they need to go see a surgeon, I can call their office. Hey, can I call your office? I could schedule with your scheduler. I could tell, then I'm walking over to this patient and saying, hey, I got you in Friday at 2:00 and they're going to take care of you. Now, I pretty much just guaranteed them a patient in the door and they spent no money on it. And then they come with my recommendation to go over there and be seen by them. And then most likely, if I'm recommending them over there, they're going to be indicated for something. Typically, is that not true? We'll typically say with, practice guidelines, if patients don't get better in 6 to 8 weeks or so, they may be indicated for surgery or something along those lines. And I tell patients that if we do the conservative treatment and you don't get better, you're more likely to have a good outcome with surgery. And I've had those patients that, with a meniscal tear, they didn't do well with therapy, referred them over to a surgeon. They come out of surgery and they're like, wow, I feel great. They come back to me and they're like, knees bending, it's straightening, pain is minimal, usually just, post-op pain. They blow through the rehab so fast on it. And they're thankful for it. And guess what? That surgeon just got a very good outcome as well, because this, therapist that, someone else said, oh, you're just sent them someone that can help. That also works the other way, which I let this provider know. We also don't have to recommend people as well. Again, think about how much time we spend with somebody. And it may not even be for the condition that they're saying. They could say, oh, my mother's having back pain. My brother's having a shoulder issue. My son's, hurt his ankle real bad and it's bothering him. Who should I go see? Well, we don't have to recommend this person because we know this person is probably not looking out for the best interest of the patient. We're going to send you over to this person. We'll refer you over to here because, we have a good relationship, and I'm not saying like anything illegal or anything like that. Like we have some kind of agreement or whatever like that. But it's like, no, this person over here with this group, they're just going to get them in and just keep them in, and they're not going to send them for rehab when which people need the rehab. We're going to send you over here where they're going to take care of you, and they're going to keep your best interest in mind. That's very important. And I let people know that, hey, we're an excellent source of all of those things. And I've had therapists who work in states where direct access is way very, very open. And they say we get physician groups that are coming into us and marketing to us to get patients from us. So they said the roles are now being reversed. We're not having to go in and market to these doctors, these doctor groups. The doctor groups are coming to us, asking us to send them patients. And I've actually had that a handful of times happen. So, people coming over and say, hey, you need to send over. And it's kind of interesting having it on that way. But I would like to know your experience in this. What do you do in those situations? Again, another provider, and that's what I say, really at the end of the day, we're all on the same team. The patient is at the center of care. We need to focus our strengths to help this person. And I understand what my role is. I would hope that a physician assistant, a MD, a surgeon, whomever, that we all understand what we bring to the table. And when we all bring those things to the table, the patient's going to get a better outcome. I don't ever try to say that I can do the things that an orthopedic surgeon can do or an MD. I don't say that. I know the rehab component of it, I'm going to do the rehab component to my best of my abilities. And if I cannot do that, or if it's something outside my scope, I'm going to send you to the person who is going to take care of you, that I feel is going to be the best one. And I would hope I would hope that if you are a physician watching this, if you're a physician assistant, a nurse practitioner, a nurse, massage therapist, chiropractor, dentist, psychologist, whoever, that we all work together. That's the thing. We're all working together, and we respect one another, and we respect what we do. And people like this guy, we don't need them. We don't. You don't need to be practicing and acting like with that attitude. And then the funniest thing is that he says on his page that he's the father of 2 amazing daughters. So this person is going to be disrespectful to a woman on the internet and then say that. And what would he say as well, which somebody pointed out, what if his daughters decided to be physical therapists? Would he be as disrespectful to them as he was to us online? But anyway, let me know. Have you dealt with that? What do you do in those situations? I want to hear from you. Talk about it. Let's talk about it. Let's chat. Let's hear about it. So if you hit the video, hit that thumbs up button. And of course, subscribe to the channel to keep up with all of these videos on topics going on in the rehab world, and also all the other little goofy things that I come up with to entertain you during your day. So with that being said, take care of yourself, take care of your patients. I will see you all next time.